coming to you today to give you some insight on Alzheimer's disease and how progressively it's come since the 1980s up into 2005, 2020, and 2022. Back in 2005, a talk show host, Neil Cohen, broadcasted a radio discussion with Dr. Mark Wexler from the which is the Wright Professor of Medical and Immunology from Wayland Medical College of Cornell University in New York City, and with Dr. Ron Peterson from the Mayo Clinic. And Neil stated that at this time in 2005, there was over 4.5 million U.S. citizens over the age of 75 dealing with Alzheimer's and onset start of some symptoms of Alzheimer's. And that means the ability to remember and function. It eats away at that. It's in your brain. It's where your brain shrinks and no longer has the ability to function in your everyday life and routine, and it's kind of frustrating for those. And since 1980, the research shows that the Alzheimer's disease has doubled, and that these doctors and neurologists, they get together once a year and try to find a way that they could slow this process down. And there's just no cure for Alzheimer's. It is very frustrating for patients and for their loved ones, because the patient sometimes gets really irritable and gets mad really at their self, because they can't remember where they put their watch the night before they went to bed, and that where they put their shoes. If they put them in the closet, they can't find them, or they go to the bathroom and they can't find their way out of the bathroom. They have to call for help, and I can see where that would be a little frustrating, a lot for me, because I'm very independent, and most people like to be independent on things on stuff like that. Then nobody needs to lead them out of the bathroom. It's frustrating. My husband's grandfather, when we first started dating, which is quite a few years back, 23 to say the least, started having symptoms of Alzheimer's, and it progressed pretty quickly on him. I guess because of his age. They say that if you have some type of head trauma, which he was in a car accident and he hit his head, and it wasn't bad, but it was an injury. He had a concussion and stuff, and he from then on he started having problems. Like he had been retired for like 15 years, and one morning a guy from his work, he was a security guard outside the gate where he worked. He was a gate security guard, and called and said, your dad, told my mother-in-law, said, your dad is here to go to work, and he has been retired for 15 years, and we can't get him to understand he doesn't work here anymore. And so my mother-in-law had to go up there and get him calmed down, and that's when they went to the doctor, and they said it was onset Alzheimer's. And it just got progressively worse since then. And that's my part of the story of my situation or my experience. And then in 2020, Nora Marisa Paco wrote in the Medical Journal of Research that it is a progressive neurodegenerative situation in your brain, that it's a protein, it's APOE gene protein that eats away at your brain cells, and it is a nightmare for patients and their loved ones. And you have to be tested for this, and they do like an MRI or something, and they can see if you have this protein. And sometimes it has to do with your age, your lifestyle, or maybe your family history. And then in February of this year, 2022, the Mayo Clinic said there was approximately 5.8 million U.S. citizens that had Alzheimer's, and a new study showed that there was only 4 out of 1,000 that from the age 65 to 74, and from age 75 to 84 was only 32, and from 85 and older was 76 out of 1,000. And this pertains to their daily routine, and you're higher risk if you have a parent or a sibling who has Down syndrome, is more likely to get Alzheimer's. And it doesn't pertain to just men or just women. There's little to no difference in men or women. They all, either way, it can be. It doesn't matter. It just affects someone that has these proteins in their brain. And Alzheimer's Research Center from Maryland said that it calls it a mind-stealing disease, which it does steal the mind. And it is just profound how it progresses on individuals. And I hope that I've given you a little insight on Alzheimer's disease, which is called AD. And maybe you can do a little more research of it on yourself. But thank you for listening.